Hey everyone, welcome back to today's Explainer. I am so incredibly excited about what we're breaking down today because we are looking at a massive, and I mean massive, leap forward in healthcare technology. We are deconstructing Baichuan-M4. And look, this isn't just another language model that answers medical trivia. We're looking at a system that completely elevates AI from a simple single-turn chatbot into a comprehensive, continuous care medical agent. Think of it less like a search engine and way more like a tireless, highly organized clinical co-pilot that actually remembers your history across multiple different visits.
Okay, let's dive into this roadmap. We're going to start by looking beyond the chatbot, then we'll explore the Baichuan-Harness system, the core reasoning engine, and its clinical perception tools before wrapping it all up with the benchmark performance and proof. So, Section 1, Beyond the AI Chatbot. Now, right out of the gate, you might be wondering, what exactly does clinical grade mean here? It is absolutely crucial that we define this. When the researchers call Baichuan-M4 clinical grade, they are talking about the AI's readiness for physician-supervised use in strictly controlled settings. It's built to assist with triage, pull together complex patient histories, and securely retrieve peer-reviewed evidence. But, and this is a big but, it is expressly not an autonomous robot doctor. It doesn't make final diagnoses, and there's no way it's writing prescriptions on its own. The stakes in a medical setting are just way too high for autonomous misdiagnoses, right? So instead, this system is a highly capable co-pilot. It operates within very rigid safety boundaries right alongside human professionals, basically augmenting what they can do while reducing all that heavy cognitive and administrative load.
Now, what's really interesting about this comparison is the stark contrast between the previous generation and this new one. Baichuan-M3 was a great foundation, sure, but it was essentially a single-visit tool. It lived entirely in the moment. Baichuan-M4, though, introduces a totally different mindset: dynamic, continuous care. It uses multi-agent tools, which means it can actually break complex medical reasoning tasks down and delegate them, rather than trying to cram everything into one single cognitive pass. And honestly, the biggest game changer? It has deep, long-term memory. Let's say a patient comes into a clinic with a persistent cough on Monday and then calls back with side effects on Thursday. M4 knows it's the exact same continuous disease episode. It inherently connects the dots over time, exactly the way a real human clinician would.
Moving on to Section 2, the Baichuan-Harness system.
Take a really close look at this architecture. If the AI model itself is the brain, well, the Baichuan-Harness is the nervous system. It controls exactly how the brain interacts with the messy real world, and it's built on four main pillars. First up, task delegation. Like I mentioned, it doesn't try to compute everything at once. It dynamically dispatches the heavy lifting, like digging through massive databases of medical literature, to specialized subagents. This frees up the main agent to focus on high-level decision-making. Second, we have dynamic role switching. Imagine a conversation suddenly shifts from checking symptoms to analyzing an X-ray. The harness just seamlessly streams a specialized radiology agent right into the chat. Third, it builds a multi-dimensional patient memory system, pulling past interactions, lab results, and demographics into one cohesive timeline. And fourth, and this is paramount, it enforces rigid safety guardrails. We're talking active blocks on unauthorized data access, redacting personal info, and guaranteeing that every single recommended action strictly follows established clinical guidelines.
Which brings us to a huge hurdle in AI deployment, the sim-to-real gap. This is what happens when an AI performs flawlessly in a pristine simulated lab, but then totally falls apart in the unpredictable, chaotic environment of a real hospital. Baichuan-M4 brilliantly bridges this gap by doing its reinforcement learning training entirely inside the harness interface itself. So, by training exactly how it's going to be deployed, the researchers guarantee that its behaviors, its tool calling habits, and its memory retrieval perfectly match the real world. Basically, it learns the strict rules of the clinic from day one.
All right, Section 3, the core reasoning engine.
So how does it actually think? Well, Baichuan-M4 improves itself using this beautifully designed three-layer nested adaptive control system. Notice how the inner loop here is entirely focused on the patient. It's acting during the live consultation, keeping the context, updating a structured patient profile, and tracking the illness so no critical history is dropped mid-chat. Then, right behind the scenes, you have the middle loop. It grabs the evaluation metrics and interaction logs from those patient visits and runs them through a reinforcement learning optimizer. This is actively improving the model's underlying behavior, training it to communicate better based on immediate feedback. And finally, the outer loop. This thing continuously scours dynamic online data to find really challenging or poorly handled medical cases and turns them into targeted optimization tasks for the whole model. It is literally a closed loop of continuous self-guided improvement. No constant human handholding required.
The researchers also threw in some profound algorithmic innovations. They're using a system called SPAR++, which assigns rewards based on specific clinical steps, like taking the initiative to ask a really good follow-up question, instead of just rewarding the final multiple-choice answer. It's rewarding the actual process of doctoring. But the absolute standout engineering feat for me is reasoning path compression. The AI literally shrinks its internal reasoning token cost down to 1/6 of the original size, with zero loss in accuracy. By taking up way less computational space to think, it dramatically speeds up response times. Plus, it frees up a massive amount of memory to store those long-term patient records right in its working memory.
Let's look at Section 4, Clinical Perception and Tools.
The external abilities this AI wields are just genuinely impressive. It goes way beyond text. It's got multimodal tools that are basically like having specialized consults on standby. Think about feeding it a faded, poorly scanned 10-page blood panel from some other clinic. M4 uses specialized medical OCR to instantly read, extract, and perfectly structure that highly specific data into the digital record. It can even help generate structured radiology reports from complex chest X-rays. And it features an evidence-driven dermatology agent. Now this is cool because it doesn't just glance at a photo of a skin lesion and take a wild guess. Instead, it systematically extracts the visual features and rigorously compares that evidence against a database of known medical concepts before it even offers a differential diagnosis.
And this brilliantly illustrates how M4 applies those tools. Let's look at this scatter plot for the Baichuan-EBM benchmark, which measures evidence-based medicine retrieval. Check out that star sitting way up in the top right quadrant. Baichuan-M4 completely crushes the competition, hitting a massive 90.0 citation precision score. How? Because it uses a highly structured retrieval process from a 6-layer pyramid containing over 40 million biomedical records, authoritative guidelines, and peer-reviewed reviews. It is not blindly searching the open web. It surgically targets the exact quality of evidence needed. Need a broad overview? It hits the review layer. Need specific dosing? It goes straight to clinical guidelines. This completely filters out the irrelevant noise and unverified blogs that totally trip up generic AI models.
Which brings us to Section 5, Benchmark Performance and Proof.
I want you to direct your attention specifically to the bottom right chart. While Baichuan-M4 leads across the board in static medical knowledge, the single most critical metric for any real medical deployment is the hallucination rate. Hallucinations, where an AI just confidently invents fake information or phantom symptoms, are without a doubt the most dangerous risk in medical AI. It's a recipe for catastrophe. But Baichuan-M4 has engineered this rate down to an incredibly low 3.3%. That is a massive, highly consequential reduction compared to the other state-of-the-art models you see here. By aggressively curbing those fabrications, it builds the foundational trust you absolutely need for real-world clinical use.
Next, we've got to examine memory, because you can't provide continuous care if your co-pilot forgets what the patient said last week. Highlighted in the far right bars is the long context clinical memory evaluation. Baichuan-M4 hits a remarkable score of 86.9. To put that into perspective for you, that is a dramatic 21.1 point jump straight up from Baichuan-M3. It easily outpaces major competitors like GPT-5.5 and DeepSeek V4 Pro. This extraordinarily high score definitively proves that M4 can handle extensive, convoluted medical histories without ever dropping those crucial red flag symptoms during follow-ups.
So, the crucial point on this next table is about optical character recognition, or OCR. Look, hospitals absolutely run on dense, noisy tables. Complex blood test results, multi-page discharge summaries, vital sign flows. Extracting structured data from these is vital. Standard language models notoriously fail at understanding table layouts, but Baichuan-M4 achieves a structured score of 0.914. It is far superior to generic vision language models. It just doesn't get confused by complex columns, messy handwriting, or those tiny little abnormality arrows pointing up or down.
And we see that same dominance in complex visual diagnostics. The F17K Dermatology Expert System Evaluation proves that M4's agent-based approach just works better. Instead of taking a quick, single, zero-shot glance at an image and just guessing, M4 relies on multi-step evidence gathering. It assesses, hypothesizes, checks the literature, and refines. And this pays off handsomely, beating out Gemini 3.1 Pro with a 30.78% exact match rate for its absolute top diagnosis.
It really proves that explicitly teaching an AI to plan a structured, evidence-based path yields demonstrably safer results. However, let's take a second to do a reality check, because it is essential we ground the hype. The research paper is completely upfront about known risks and limitations. Due to the nature of its training data, M4 still struggles heavily with long-tail rare diseases, or symptoms that highly deviate from the textbook cases. Also, there's a strict, non-negotiable need for human verification. In multimodal tasks, like interpreting an X-ray, the AI's output can be completely thrown off by simple environmental factors, poor lighting, a patient moving, or a low-res scan. So these outputs must always be treated as assistive signals that a highly trained clinician ultimately verifies.
And that brings us to the end of our breakdown. We've seen how Baichuan-M4 utilizes specialized subagents, dynamic long-term memory, and tightly controlled evidence retrieval to transition AI into a truly reliable tool for continuous care. But I want to leave you with a really profound question. As artificial intelligence permanently shifts from simple text chatbots to these incredibly capable clinical copilots, how will human medical practice and hospital workflows actually evolve to effectively supervise and trust these tools? The tech is clearly ready to assist, but now the clinical workflow itself has to adapt. Thank you so much for joining me on this explainer. Keep learning, and I'll catch you on the next one.